Hello, my name is Bailey Brown, and today I will be talking about schizophrenia. As defined by experiencing psychology, schizophrenia is a severe disease disordered by the thought process. Symptoms of schizophrenia typically progress slowly and can take months up to years to fully develop. Starting out symptoms may be feelings of irritability or tenseness, trouble concentrating and or sleeping. These symptoms of schizophrenia are often mild and unnoticed. Progressed symptoms are strange behaviors, hallucinations, isolation, lack of emotion, and delusions. There are three types of symptoms. There are positive symptoms, which basically is an excess of normal function. Negative symptoms, which are a decrease in normal function, and cognitive symptoms. These are typically unnoticed and include difficulty sustaining attention, problems holding information in memory, and inability to interpret information and make decisions. Cognitive symptoms typically can only be detected by neuropsychological tests. There are three types of schizophrenia. The paranoid one is the most common. It's accompanied with anger, anxiety, and false thoughts. Disorganized is accompanied with childlike behavior like little emotion, unclear thoughts, and explanations. Catatonic schizophrenia is accompanied with odd facial expressions, unresponsive, incorrect posture, and lack of activity. This is often confused by a lot of different things like muscular dystrophy, because you don't realize that you're moving around a lot or making an odd face, which can be confused with Tourette's. But typically, you're only going to be diagnosed with schizophrenia if you're in a psychological hospital. Over half of the patients in a psychological hospital have been diagnosed with schizophrenia. 8 times that of the general population is at a suicide risk when diagnosed with schizophrenia. There are many cases of schizophrenia that have one or more types of schizophrenia. This is called undifferentiated. The test and diagnosis that come along with schizophrenia are a bit shaky. There is no true test to diagnose, but brain scans can be used to rule out other illnesses. This is the first step that is typically taken before diagnosing. A licensed psychologist must diagnose after meeting with the patient and the patient's family. The job of the psychologist is to find out how long and progressed the symptoms have become, the developmental, family medical, and genetic history. It is thought that schizophrenia can be passed on generation to generation. The psychologist's job is to rule out any other illness and break down to see if possibly schizophrenia is something that runs in the family, because then the patient would be more apt to having schizophrenia. This helps to not diagnose with the wrong illness, which can prevent the patient from getting better. There are effects to all medication, just like you would expect, but the effects of medication used for schizophrenia is a bit not wanted, because it can lead to depression, suicidal thoughts, suicidal attempts. You may become tired, feel faint or fatigue, and it is advised to take this medicine at night, no matter what it's for. Actually, it's advised now that you should be taking your medicine at night. As mentioned, to treat schizophrenia, medication may be necessary. The most common relapse for individuals with schizophrenia is that patients stop taking their medicine. Once you stop taking your medicine, the effects of schizophrenia may only get worse. There are many interesting things about schizophrenia that people don't understand. Most people just put together that schizophrenia is a psychotic disorder. It is something that many people suffer from each day. It is typically a disease that makes a person an outcast or an outsider, and that's really not what the case is. It's a chemical imbalance in your brain that you really can't help that you have. No matter how you got it, how you're treating it, what you're doing with it, no one deserves to be treated wrong or bad all over a disease. In many ways, you can find that they're very friendly as long as you don't catch them on a wrong day or a bad day. And sometimes little things that people do to make fun of them really is just setting them off. Schizophrenia is a psychotic disorder characterized by disorientation. If treated the right way and handled how it should be, you should be safe and able to be around them in an average daily environment. And they're hoping that one day that can be possible. I've also included my citations. I know it's kind of hard to read, but I will email them or anything if anyone wants more information. I hope that I helped you learn a little bit more about schizophrenia and helped you to realize that it really isn't something for just crazy people, that people every day have it and sometimes you don't even realize it. Thank you.